Anyway, you were amazing. Thank you so much. We're going to just transition now. I can't believe it. Time has flown by. We are going to segue into our closing plenary, and we're going to do a little transition with the tables. But in the meantime, thank you again for our panelists, and we really enjoyed those panel discussions. And now I'm going to introduce our Associate Director, Dr. Ndola Prata of the UC Global Health Institute. Dr. Prata is a physician and medical demographer from Angola. She earned her medical degree from the University of Angola and a Master of Science in Medical Demography from the London School of Hygiene and Tropical Medicine. Her research areas are in family planning and maternal health, and her current projects investigate strategies for harnessing existing resources, including human capacity and healthcare infrastructure, while also gathering evidence for setting priorities on national health agendas. Please join me in welcoming Ndola to the stage.
Good afternoon, everybody. Can I get a good afternoon, everybody? There's like some energy. It's the end of the afternoon, a little bit of energy. Thank you, San, for the introduction. So it's my great pleasure to introduce, this is the last session, so it's my great pleasure to introduce our keynote speaker, Frank Mugisha. Frank Mugisha is a prominent advocate for the rights of LGBT persons, a respected champion of human rights, and an anti-violence advocate. Frank bravely continues to work for the security, equality, and dignity of Uganda's LGBT community. And he has given motivated lectures and talks around the world and continues to live in Uganda and work towards changing the laws against LGBTQ people. So it's my great honor and it's our pleasure to welcome Frank to our UC Global Health Day.
Thank you very much for that very good introduction. Like introduced, I'm from Uganda, and I will be talking about LGBTQ human rights and how that intersects with health, but also I'll talk about how it is important to involve communities in advocacy for health, but also for human rights. So thank you so much for having me here today. And thank you to all the organizers. I'll begin with my talk today, talking about the background of LGBTQ human rights in Africa. And then I'll distinguish Uganda. And then I'll talk about the role of community and the role of advocacy in shaping access to health. So at the moment many countries in Africa criminalize homosexuality, about 33 out of the 55. But there are different attitudes towards homosexuality in the African continent, and there's very good history that is rich that shows that homosexuality did exist in Africa for many years. In most cases, when I'm giving talks, I pose a question: is homosexuality alien to Africa or not? And I ask participants to think about that. Growing up in Africa and Uganda, I did not see the attitudes I am seeing at this moment as a young boy. Attitudes have shifted. There's history. Anthropologists have written about the existence of homosexuality in our own cultures. For instance, in my own country, one of our kingdom in central Uganda, there was rumor that one of the king was LGBTQ. And in Sierra Leone, Nigeria, Kenya, Ghana, there's very good history to show that. But being an advocate from Uganda, in many cases when I'm asked a question, is homosexuality Ugandan or African? I give a very simple answer. We have so many languages and tribes and dialects in Uganda, and all of them have a reference to homosexuality. So I tell them, these tribes go way back in time. The fact that they have a reference to homosexuality, it means that LGBTQ persons have always existed in Uganda. I wanted to mention some progress in some countries in Africa. South Africa, for instance, has one of the best laws that protect LGBTQ human rights, but still LGBTQ persons face a lot of threats. Seychelles, Lesotho, Angola, and Mozambique have some levels of protection, but still the acceptance in the communities is not as much as we see protections around the world. Now I want to talk about Uganda. Like I mentioned, I'll distinguish Uganda. I come from Uganda, and many people who know Uganda is known for so many different things. One, we're a tourist country. We are located in East Africa, very close to Kenya, Tanzania, Rwanda, and Southern Sudan. We are a landlocked country with about 48 million people. The biggest percentage of Ugandans is under the age of 35, about 75%, and about 16% under the age of 16. It's a country that is notorious for so many things. One, we have very good progress on HIV and AIDS. Number two, it's a country that is known to be friendly. In fact, at some point, Winston Churchill called Uganda the Pearl of Africa. Up to now, it's still called the Pearl of Africa. And many people who have visited Uganda will know that it is actually very green and friendly. And then most recently, it's known for criminalizing LGBTQ persons. When I travel and I go in a taxi, I tell people I'm from Uganda. They are like, you're the country that kills gay people. And then some people ask me of Idi Amin. So we're also known for Idi Amin. And then I tell taxi people that I am actually the activist doing the work in Uganda. They ask me questions. Are you safe? How do you get back into the country? Do you live there? I'm like, yes, I live there. So I will distinguish Uganda today. Homosexuality in my country was criminalized in the 1950s by the British. Same-sex relations. In my country, the culture of talking about sex is a taboo itself. So talking about sexuality becomes even more difficult, especially for young people. I grew up in the country, almost every person my age would know of someone who has either been affected by HIV and AIDS, a family member or a friend. Every person my age will know someone who has had challenges accessing proper medical health. Every person my age will know someone who has had challenges, either their family member or a friend, with child mortality or accessing accessing treatment for a pregnant mother. So growing up in Uganda, in school, we had information on discrimination because, again, my country was doing very well on HIV and AIDS. I remember being very active in art and drama in my school that was addressing stigma. But that progress was held back because church leaders were involved in leadership on health. At some point, my president was asked a question at a conference. You're doing very good on HIV and AIDS. How about the LGBTQ persons? He said, we don't have them in my country. And when he came back to Uganda, he was shocked that the LGBTQ persons, he said, arrest them. Arrest them. Why are they? Who are they? I just said we don't have them. My very first time to get positive information about sexuality was in a teenage magazine. I read that magazine and I held on to that magazine for a very long time because it's the only source of information I had. But those magazines that were being published about 10 years ago are now banned because church leaders were saying sex should not be on the streets, because that is information on comprehensive sexuality education, information for teenagers on safe sex. That was banned. So what is the problem? One, there's argument that LGBTQ persons are responsible for HIV and AIDS. That's a myth, as we know. LGBTQ persons are pedophiles, recruit children into homosexuality. LGBTQ human rights are seen as promotion of Western ideologies. Homosexuality is not African, it's an import. If we embrace LGBTQ persons, there won't be any population growth. And I've had an argument that, look at countries that never criminalized homosexuality before. People are still religious. Their populations are growing. There is no any empirical data to show that male homosexuals abuse children more than heterosexual male. In fact, if you look at data in my country, the abuse of girls is mostly by heterosexual men. So the culture is an issue. The media as well, religion, lack of information, the fear of the unknown, and definitely politics. Because many politicians weaponize marginalized persons for their own gains. So I'll briefly talk about the Anti-Homosexuality Act because that has been the biggest issue for Uganda for a long time. My country just recently introduced a law that would criminalize LGBTQ persons to up to death penalty. This is the second time such a law is being introduced. And by the way, we already have a law in my country that criminalizes homosexuality. So I just wanted to talk about two of the clauses in this legislation that affect public health. One is criminalizing HIV and AIDS. So under this new law, it would be a criminal for any LGBTQ person living with HIV and AIDS to enter a relationship. Number two, the criminalization of promotion of homosexuality. So any work, any information that is targeting the LGBTQ community would be regarded as promotion of homosexuality. Institutions implementing very important work on HIV and AIDS or public health for the LGBT community would be criminalized up to 20 years in prison. We have seen effects and how this legislation has affected service delivery for marginalized people, seeing LGBTQ organizations being shut down. The law requires doctors to report an LGBTQ person to the authority. That means people are going to shy away from services because they are scared of going to practitioners. This has meant less trust into medical practitioners, making public health services impossible to access by LGBTQ persons and sex work persons. So the surge in violence because of this legislation has driven the LGBTQ community more underground, and we've seen that accessing health services has become, the numbers have reduced of LGBT persons who access services. So we're fighting so hard as communities to make sure that criminalization is stopped, human rights are respected. If we are to defeat HIV and AIDS by 2030, we have to make sure that communities are not criminalized. I talked about discriminatory laws and how they are bad for health services, for access to health. We do a lot of advocacy as a community in the country. And from our advocacy, even with the legislation in place, we've gotten a policy from the our Ministry of Health to issue a public circular and ask medical practitioners that continue providing services even if there is this legislation. Just when the legislation was just introduced in Uganda, a transgender woman went to access services and was denied services by a medical doctor. The medical doctor said, "You do not belong in this facility." And the person had to leave. In fact, we had to spend almost 24 hours looking for this transgender woman, not knowing how they are, because they had to flee the hospital where they had gone to seek services. Through our work, when the legislation was introduced, we interviewed about 695 members of the LGBTQ community. 39 reported to have faced discrimination at health facilities. 29 had heard of individuals who had faced discrimination. And 61% did not know if they had any protection if they went to seek services. That means they were afraid to go and seek services because they felt they could be criminalized, they would be criminals. If a doctor is supposed to report you to the authorities, then you would be scared to go to the health services. Trauma, we've seen trauma within the community. We've documented so many cases of mental health. Prior to the introduction of this legislation, we saw the Ugandan society being radicalized into hatred. I was vilified. I couldn't leave my house for a very long time. I was afraid even of phone calls coming to my phone because I had charges. I was being questioned by all security agencies in the country. And I was wanted for arrest by many security agencies. So this trauma that is peddled by the media, by the anti-gay and anti-gender groups, has increased the trauma in the LGBTQ community. Unfortunately, some of the challenges we're seeing on the African continent that are affecting work on LGBTQ human rights, gender rights, and sexual and reproductive health are peddled by not Ugandans, but some American Christians who partner with African politicians. One of the American Christians who was in Uganda and supported the anti-gay legislation that was called the Kill the Gays Bill in 2009 that had a death penalty. My organization and myself held him accountable here in America. We sued him in the court in Massachusetts. Thank you. Thank you. And for the first time, a judge said that persecuting LGBTQ persons could amount to crimes against humanity. And our case was allowed to go on in a district court in Massachusetts. But for us, holding accountable some people who promote hatred is to send a message that you cannot promote hatred against a marginalized community. And we're saying that the anti-gay and anti-gender groups are not only targeting LGBTQ persons. At the moment in my country, comprehensive sexuality education curriculum has not been approved because the church groups are saying that is promoting promiscuity in the country, in the schools. that if you introduce a curriculum like this, it's going to allow teenage pregnancy, it's going to promote teenage sex, which will later result into teenage pregnancy. And teenagers will end up engaging in early sex. They promote conversion therapy that has been outlawed by many countries. Recently, the president of Family Watch International was in my country, Uganda, persuading the president of Uganda to offer them land to put up a state-of-the-art facility that would offer conversion therapy in Uganda, and said other countries will embrace this. The same supporters of the anti-gay legislation are now trying to introduce a legislation in Uganda that would outlaw women who are not married from accessing IVF. They're trying to introduce a law in Uganda called the miniskirt law that would literally enforce how women dress. The law they are trying to introduce, that is now at committee level, that would outlaw women from accessing IVF, also would outlaw any woman from accessing any kind of fertility treatment if you don't have, either you've not been diagnosed with any illness that stops you from becoming pregnant, or if your husband has a fertility issue. If you're in a married couple and your husband has a doctor's letter that says we have a fertility issue, then you can get surrogacy. If not, then you can't do that. So these are draconian conservative legislation being introduced in my country. But I wanted to show you that the ripple effect is not only in Uganda, it is spreading out to other countries. Just in March last year, before the introduction of the anti-gay legislation, we had a conference in Uganda that was attended by Family Watch International and other extreme conservative groups. And one of the members of parliament from Kenya who attended this conference went to Kenya and is trying to introduce another legislation, an anti-gay legislation. Just about a few days ago, not even 2 weeks, Ghana introduced a similar legislation, an anti-gay legislation. So the ripple effect we're seeing is spreading out in the African continent. So my talk today was really aimed at community response, advocacy, and how communities can engage. One is documentation is very important. We document violations. These violations are used for advocacy. Just last year alone, we documented over 300 cases of violation. And many of these cases are from non-state actors. That shows you how much the country has been radicalized with these conspiracy theories. Unfortunately, they are becoming normal. We're seeing politicians talking about conspiracy theories, and people believe them. And they have platforms to talk about these conspiracy theories. Unfortunately, such hatred is now manifesting into violence. Mental health and trauma for so many LGBTQ persons around the world. We do a lot of high-level advocacy within the Global Fund, making sure that we're in country coordinating mechanisms, PEPFAR. We have a country-led monitoring mechanism that helps us monitor health facilities to make sure that key populations and LGBTQ persons are receiving services. We do online campaigns, building coalitions that are cross-cutting, making sure that the voice is not only LGBTQ, women's rights, reproductive health, and other human rights organizations. And of course, litigation. Right now, we are in court in my country challenging the anti-gay legislation. I'm one of the petitioners. We expect a verdict soon. Hopefully, it is positive, and if it's not positive, we definitely continue to our Supreme Court. We've seen response, international response as well come in. The US responded positively to the anti-gay legislation in Uganda. The World Bank, businesses, and other civil society organizations. Our community advocacy of building coalitions, working with communities, creating visibility, and making sure that communities receive services. We've built community initiatives like drop-in centers that provide access to tailored services to the LGBTQ community. And we do advocacy within our own government to make sure there are policy reforms that will make sure that LGBTQ persons and other marginalized groups are still receiving services. It is very important, one, make sure that global health access, it is global health access, and not only Western or developed countries' health access. We have to address inequalities of marginalized populations, young people, LGBTQ persons, women, young mothers. In my country at this moment, during COVID, many young people were not in school, and so many young people got pregnant. At this point, young pregnant girls are not allowed to go to schools because church groups and leaders are saying that they are going to spoil the good children. But we all know the circumstances why this has happened. Defilement is very high in my country. So we should look at the issue as a global health issue. But also let us look at homophobia and transphobia as a global issue. The gains that have been made in developed countries are going to be reversed. At some point, HIV and AIDS was seen as an African problem, an African disease, until international organizations and advocates started saying, let us address this issue as a global issue. We still have transgender persons being discriminated. I think Uganda has passed an anti-gay legislation. The US has passed the most anti-gay legislations in the world, I think, this year. So the gains that have been made are being reversed. Previous speakers have eloquently spoken how many gains have been reversed and overturned here in the US. So let us start addressing this as a cross-cutting movement and global issues. And then I come back and answer my question. It is homophobia that is Western. Because I have shown you, homosexuality was first criminalized by the British. Right now, all the anti-gay legislations are not ours. They're being supported by extreme anti-gay and anti-gender groups. I came out at the age of 14 in my country. And during that time, as a young boy, I was never worried of getting arrested. I was never worried of getting killed. I was never worried of getting beaten. Right now, a young 14-year-old boy in my country would be worried of coming out. Either they would think they would be arrested, they would be beaten, or they could get killed. The narrative has shifted. It's become very volatile and extremely difficult to live in Uganda and be LGBTQ. What can you do? Definitely international solidarity is very good. Research and data. Funding. The anti-gay and anti-gender groups have unmatched funding that goes into Africa. We can't match it. We need resources. Global solidarity is very important. Join all the campaigns that you see that are addressing these issues. Ending inequalities, that should be in bold and in red. We should end inequalities if we want to get global access. LGBTQ human rights as a health issue. If we do not stop criminalization, we're not going to succeed in getting the health rates that we want. Cross-cutting movement. We need to work together as a collective because it is gender rights that are under attack, it is LGBT human rights under attack, and reproductive health under attack. In my conclusion, people ask me many times, you are in America, United States, and you're talking about LGBTQ human rights. Won't it be problematic if the US steps in and speaks? I don't propose that the US should be lecturing Uganda on what to do, but I'm also saying the US is a partner of Uganda. PEPFAR funds almost 90% of life-saving medication to Uganda. The United States sees Uganda as a country that provides regional security. There's partnerships. And these partnerships, the funds are coming from the American people. So, but when you come to African countries and other authoritarian countries and you talk about human rights, that is when they remember sovereignty. I think there should be accountability and partnership should be respected. Rule of law. So in my conclusion, I think we shouldn't shy away from difficult topics. We should stand up and speak up where there are inequalities. And we should look at this as a cross-cutting movement. Thank you very much.
Thank you so much, Frank. Yes, can you take this one? Let's have a conversation now. I'm so excited. Okay. Well, let me start by saying, well, thank you so much for all what you do for Uganda, for Africa, for the world, with respect to the rights of LGBTQ community. I'm originally from Angola, one of the countries that you mentioned that has passed more laws that allow for LGBTQ, but as you know, there's this passing of the law, and then there is what's happened in the community. Just recently, just a few days ago, one of the prominent LGBTQ advocate was found dead in difficult circumstances. So that still exists. Some of the challenges that you mentioned in your presentation, religion, cultural norms, social norms, how do you see sort of the movement affecting some of those interactions? Let me tell you a little story that my grandmother told me. So when we are born in our ethnic group, we are assigned an animal based on the month, similar to what different cultures have, the year of the dragon, the year of the rat, so we are assigned each one of us. But they have no gender.
Yeah.
Isn't that interesting?
Yeah.
So before, in Angola, my understanding, for example, is that before Christianity came and made the sort of the sex division, and to a certain extent influence a lot of the social norms with regards to male and female and how dichotomy that is, it was a little bit more fluid. You know, women more visible if a man lives only with a man, but if two women live together, you know, it would be, no one would make no one would notice except for the lack of children. So how do you think the movement can affect some of those social norms, or going back to initially, because you do conclude that homophobia is the issue, not the lack of sort of the experience or the existence of homosexuality. So how do you think that the movement in the world or in Africa can affect some of those sort of current issues related to homophobia?
Thank you very much. Well, thank you for the examples. Looking at the culture, I think I will begin with a practical one. For instance, the culture of holding hands. Now, if you hold hands, a man and a man is seen as people will say you are homosexuals. I grew up in a country where holding hands, a man and a man, was seen as a sign of friendship. You're very close to each other, and never at any point would someone point it out as homosexuality. So some of those cultural norms that we had in the past are now, being weaponized into identity, and also in my country we have women who are royal. They will be addressed as sir, and so other women will address them as husband. And so in some culture settings, they actually took on wives. And that was normal and was allowed. But now if it happens, then it is seen as same-sex. So there are so many cultural examples I would give that have been either diluted or erased. And we've said this many times as activists, that not only our culture norms, but even our way of living, thinking, was demonized. If I give examples out of LGBTQ human rights and look at, in my country we have petty offenses that would criminalize, if they found someone hanging out somewhere when they're not supposed to be, they would charge them with a petty offense of idle and disorderly or vagrant vagabond. These were introduced by the British because they never wanted people loitering around their houses. So the discriminatory policies have been enshrined into our own culture that, has dismantled the culture setting that we had as Africa. We have what is called Ubuntu in Africa, togetherness, where our own societies never embraced anything discriminatory. But that has been dismantled. Yeah.
Thank you so much. Any questions because I can go on and on the rest of the day, but any questions from the audience? Yes.
Thank you so much, Frank. I'm struck by what you ended with about the need for a coalition among groups of people. Who have been, I would say, your greatest supporters in your work from within and outside of the LGBTQ community? And kind of what, have any of those groups been from outside the United States that we could also, or outside of Uganda, I'm sorry, that we could continue to support from here?
Thank you. We have had support from women's rights groups, mostly, other human rights organizations, legal entities. When we were holding Scott Lively accountable, we worked with many groups in the US here, groups working on civil liberties, LGBTQ groups, especially from Springfield in Massachusetts. We worked with legal groups here in the US. And we also have a lot of support from universities Right now, I'm doing a fellowship with Secretary Clinton at Columbia University, so I have a lot of support from universities as well, other human rights institutions. But domestically in the country, most of the support is from women's rights groups. The LGBTQ issue is a bit difficult for other human rights organizations to work on because there is shrinking civic space for many organizations. So we've seen organizations being shut down for working with us or working on other political issues. So it becomes really difficult. But some of the groups work with women's rights groups, but also lawyers. Our friend Nicolas Opio, who is a very good lawyer on civil liberties, and other organizations, yeah.
Any other questions? Yes, thank you.
Hi, thank you for your great presentation. I was a bit curious about how the international lawsuit was interpreted domestically in Uganda by Ugandans. Were people supportive or against that? And is that a route of activism that you're interested in continuing to pursue?
Thank you. So the lawsuit in Uganda against Scott Lively was not well received by Ugandans. So because Ugandans are very Christian. We have about, it's estimated around 80% are Christian, Catholic, Anglican, and Christian evangelicals. So taking to court a Christian leader is seen as blasphemy because we are taught that you shouldn't hold a Christian leader accountable. You shouldn't speak. If you're Christian, if a church leader speaks, he shouldn't repeat. Ugandans are very faithful. So that was one, because of the faith. And then number two is because the propaganda, the conspiracy theories, Ugandans believe that Christians are right in saying homosexuality is wrong, it's un-African, they are abusing children, and all those conspiracy theories were believed. But for some Ugandans who are critical thinkers, first they uploaded how smart we are, because we are non-Americans, then holding American accountable using a very, a law that we found somewhere, the Alien Tort Statute. I'm told it's not used anymore. And secondly, the exposure. And during the time of the process of the litigation here, when we're doing the discovery and all that stuff, we discovered a lot of information because they were compelled to share their corresponding emails with American Christians and the Ugandan politicians. And we learned firsthand that they indeed did support the legislation, and we exposed some of this information to the media. So some Ugandans were like, you know, there was something to learn. And then number two, we silenced the exportation of hatred for some time, because we're seeing less and less extreme American Christians, and even from other countries, coming to Uganda in big stadiums and spreading hatred. And one of the co-conspirator for Scott Lively, who is the biggest, who is the most prominent anti-gay preacher, disappeared for 2 years. Because we also discovered during the discovery that he's Ugandan American. And so he had other tax issues, so he disappeared off the scene. So it was, but the exposure and the advocacy that was done around that by partners and many people. And we had, in fact, at some point, it was in the Ugandan newspaper that someone was looking for him because of the exposure around the law. So we got a bit of a breather during that time. Yeah.
Yes, please.
Thank you so much for sharing your story. And as I've been sitting here, sort of wondered, and you know, the pictures that you showed and your story that you're talking about, and the newspaper clippings, really it's vilifying gay males for the most part, from what I was seeing and what you were referring to. But I was just curious, are lesbian women attacked or seen in the same way, or like why is there a difference there? Because you said that there's women's advocacy groups who are really advocating for you in Uganda, but is it to protect lesbian women's rights, or just educate me a little bit more, please.
Thank you for that question. Criminalization of homosexuality in Uganda by the British, the law that we've had for over 50 years, criminalizes carnal knowledge against the order of nature. So it criminalizes men mostly. And the negative media, the propaganda is all about two men. And it's mostly really about sex. In Uganda, when I'm speaking, sometimes I have to make a disclaimer and say, I am not interested sexually in any man in this room. And as a gay man, I have a type. And I can walk around the streets of Uganda for 3 months without even seeing someone I like. So then men get comfortable. They're like, oh, you don't want us. And because it's all sexualized. I walk in the room and I'm already sexualized even before I start speaking as a gay man. So it is that sexualization of men. And then, I was in a room and someone said that I can't believe as an African man you would want to be submissive. So every person is actually sexualizing me. And on top of that, they think I'm submissive because it's all they think about is sex. And so it is that patriarchy where men do not want men to act as women. In their thinking that if you are gay, then you're having sex, and you're having sex in a submissive way as a woman. And so the extreme fear and anger is mostly towards gay males. But legislation targets everyone. Gay, lesbian, bisexual, transgender persons. Discrimination, the same. Community violence is so much towards men, but towards lesbian women as well. So for lesbian women, it's mostly anger. Why are you lesbian? Yet they're men. And so we've seen many lesbian community members getting sexually abused, with corrective rape by their own families sometimes by their own people they think who pretend to be their friends, because they're saying, why are you lesbian? We're trying to correct you. This is the right way to have sex. So we have got very many cases of lesbian women who are reporting sexual abuse, and it has increased with the introduction of this legislation. Thank you.
Any more questions? Otherwise, we have a little bit more time. Okay, so, there is a question. Yes, please.
Hello. First of all, I wanted to say thank you for coming and sharing your story. It's really inspiring to see you here. So there's some background to my question. My question is, do you see or anticipate there being a backwards trend to this pre-colonial mindset or traditional values? Like growing up with immigrant parents, I remember as a child, my peers would often bully me for bringing Indian food to school, or if I showed up with henna on my hands, it was, what skin disease do you have? And over the years, there's been this cultural trend where it's, no, Indian food is really delicious. Oh, like henna, can you do it on me? And so I've personally seen that like cultural shift, and I think it's because mainly social media. And do you anticipate certain cultural changes happening in Uganda, similar to what my experiences have shown, or do you think it's something that's deeply rooted and needs large-scale changes? Thank you.
Thank you very much. Yes, I definitely am I'm optimistic that there will be change. And number two, like I mentioned in my talk earlier, Uganda is 75% under the age of 35 and 50% under the age of 16. So many, many young people are more progressive. And then number two, thanks to America and pop culture, many Ugandans watch television and they see how their favorite celebrities are accepting and tolerant LGBTQ persons. So they also are like, if I love Rihanna and Rihanna is progressive, then I should be progressive. If I love this footballer and this footballer is progressive, I should be progressive. I have seen some young people challenge their own parents on draconian ideologies. The only challenge we have is that as a culture and as a society, young people are suppressed so much. Most places of leadership, it's adults allowed to speak. You can't speak back to your dad or mom. So sometimes it's very hard. But the culture shift is there, and definitely it's progressing. It's a trajectory that cannot be stopped. There are people who LGBTQ and young, and their friends accept them. They can't say anything at home. There are transgender people who have changed clothes. If they leave home in different clothes with their friends, they have different clothes. When they're going home, they change. So because their friends accept them, but their friends can't speak about it, they can't speak about it. Their community, I got house parties in Uganda where there's acceptance within a small group of peers. I approach government. I speak to government officials. I have been, one government official the other day said, I'm like a madman. I'm like, you're like the madman in the market. Everyone is going to look at you and won't want to harm you. But I also use a lot of diplomacy and proactive to do advocacy. So the culture will help us to shift a lot of mindsets in the country. It will take a very long time, but I know it will happen. Thank you.
I also am very hopeful, and I think that, I don't know what you think, Frank, but I think that one of the ingredients is if we have comprehensive sexual education, age appropriate, but starting very early in elementary school, that is also gender sensitive. So that from very early age, we learn to respect and accept that some of us are different. And one thing is the assignment of the sex at birth because of the genitalia that is presented, because it's the only way that the medical community knows how to assign sex, but that people have the ability to evolve and then in their hearts feel different. And which is separate from then, once you feel a certain way, associated or not, with the sex that was assigned at birth, your inclination for being attracted to another gender is a separate matter. So I think that there's a lot that we could teach in schools that will make young people understand where all this comes from, and then be able to have the tools to argue with their parents that may be coming from a place of, this is what the church is telling us. So that they have more sort of a scientific and sociological knowledge and tools to address those. So, but unfortunately, in most of our countries in Africa, comprehensive sex ed, it's a very far from a reality at this point.
In fact, my country has refused to approve comprehensive sexuality education in schools. The curriculum has not been approved for 3 years now because it simply says that there is same-sex sexuality. At some point, UNICEF was almost kicked out of the country because they had a book for young people that did give reference same-sex education. And if you talk about sexuality and same-sex to young people in my country, people will see you as someone who's trying to recruit the young people into homosexuality. So there's still a lot. But like I mentioned, those conservative ideologies, they really have no time in modern society. At some point, they will start phasing out. And the fortunate thing is that the young people themselves are beginning to challenge these very draconian ideologies and saying, look, I know this from the internet, I know this from TV, I know this from TikTok, I know this from, Twitter. And so they are questioning the adults who were, coming up with all these conspiracy theories, and they're saying, no, you're not right. This is what I've read.
Yes.
To follow up on the previous questions, there we have a question from the virtual audience asking about what have been the most effective ways to build empathy among ordinary Ugandans for LGBTQ plus people.
Thank you. That is a difficult question. The effective way has been, one, trying to do advocacy in the Ugandan context. So, for instance, showing Ugandans that LGBTQ persons always existed and giving reference, like I mentioned in my talk, that look, in every language, in every tribe in this country, there's a reference to homosexuality. And then number two, showing Ugandans that we are normal. The very first time in Uganda we had a visibility campaign, we called it Let Us Live in Peace. And the idea was to tell Ugandans we don't want anything, we just want to live with you in peace. And the campaign, we went in media wearing masks, and we were telling Ugandans behind this mask, it could be your doctor, your uncle, your brother, any person who is close to you. But simply because you're not accepting, they cannot come out to you and tell you. And then we've also working through the women's rights groups and speaking to parents and telling them, if you're not open with your child in discussing issues around sexuality, they are going to get this information from the internet or from somewhere else that could be harmful. So be open, be embracing. If your child tells you they are LGBTQ, learn and accept them and listen to them instead of letting them, go to get information from somewhere else. But most importantly, because this is advocacy that we do, but most importantly, like I mentioned, getting empathy from Ugandans has been by getting people they can listen to. Church leaders, we have one church leader who is outspoken and very supportive, an Anglican bishop, but unfortunately, his church has excommunicated him and cut off his pension because of working with us, but he has been able to reach a lot of communities and educate them about LGBTQ. And he uses one simple language. He tells people, forget about sexuality and sex, but think about companionship. Every person needs to be happy, needs to have companionship, needs to be in love with someone they like, someone of their choosing. And then the other is what I mentioned, getting influential people, celebrities in Uganda, and like even international and soccer players who resonate with many other things in Uganda, but also getting Ugandans to address LGBTQ human rights as part of broader human rights issues. That is now the civil society groups. And then working with local communities in our own local settings where we feel that LGBTQ persons are being discriminated the most. We go and try to do one-on-one campaigns and education within those societies and show them that LGBTQ persons are like any other Ugandan and try to create empathy with the Ugandans. But also most importantly, doing the advocacy in a Ugandan context and not being combative and being very proactive, that's where I do my advocacy, that has really changed some hearts and minds of Ugandans. Showing them that, you know, I'm Ugandan, I've gone to school here, I've had to work hard to get good grades, I've had to respect my parents, I still go home and respect my grandparents, and showing a Ugandan picture, but I am still gay. Thank you.
One last question, just a curiosity. How did the Ugandans reacted to the latest sort of a position of the Pope with respect to homosexuality?
Uganda, like I mentioned, is very Catholic, and I am Catholic. So if the Pope says anything, I still call the Pope the Holy Father. And if I meet a church, I bow. I don't practice as much, but I am still very faithful because I come from a Catholic background. So that shows you how Ugandans are faithful. They respect the Pope's decision. The Catholic Church has not been very active in promoting the anti-gay legislation because of the Pope's position. But we're seeing now the Catholic Church really creating more defense around same-sex marriage. But many Catholics, even people I know, my own family relatives, they are rethinking their own homophobia and transphobia because of the Pope's view. So it's been very progressive, and we've been saying as Ugandan and from Africa, saying the Pope and more influential people like the Pope should speak out more. Thank you.
One last question, one that sort of concerns me particularly as a public health professional working in, you know, also providing care, sexual and reproductive health care. What the laws in Uganda and in other places bring about is sort of a tremendous inequalities when it comes to access to healthcare by LGBTQ. Do you see any movement? And I see, for example, in the case of Uganda, there are specific laws that actually will require physicians to report. So is this something that, for example, in the case of Uganda, what is the position of the Medical Association, of the Midwifery Association? Will they comply? Will they go against the law and do something about it?
Thank you. There is an entry point for advocacy when it comes to public health, and that is as much as that is where most of our advocacy lies. There are some medical practitioners and medical facilities that are very homophobic and transphobic. They will deny services to LGBTQ persons, but like I mentioned in my presentation, the Minister of Health issued a circular asking all doctors to provide treatment to LGBTQ persons without discrimination, even if the law is there. We have approached some medical associations who have not come out in support of our work or in support of the legislation, but I believe with more advocacy, we may see them coming forward and supporting. But simply, the other has been, unfortunately, using money, getting some of the funding that they receive to be questioned, that if you're receiving this funding, are you inclusive? Are you not being discriminatory? Because if you still, because for example, some of the church groups have had to lose their funding, unfortunately, because then the funders have been asking them, you're not going to be able to implement these projects properly if you're still discriminating people. And then most recently in Uganda, with the Medical Science Researchers Association issued a directive asking all researchers to report LGBTQ respondents. And unfortunately, again, many researchers working in Uganda have lost money because many countries don't want to support them because they're saying, how are you going to conduct research in a country where the National Council is outlawing or telling you to report on any LGBTQ respondents? So it is a 50-50 issue, but there are entry points for advocacy when it comes to health. Yeah.
Thank you so much. And thank you for coming from so far away to talk to us today, and thank you for the work that you do. We will end this session with a few words that I have for the group. But please, let's give a round of applause to our guest, Frank.